When you mix the knowledge that you gain from the Rotman MBA with what you learn from the digital health perspective that Silicon Valley provides, it's really an opportunity to put it all in context and do something really meaningful to impact care.
Healthcare is rapidly changing. The emphasis is turning more and more onto a value-based system where patient outcomes are the most important thing. It's becoming more and more apparent how digitization in the healthcare sector is going to be very, very important.
Being in the life sciences and being in healthcare, we're taught to think a certain way, and we put a lot of constraints around the way that we think. The methodology around design thinking is very different. So for me, it's really shifted everything on its ear, and it's allowed me to explore how I think and how I can process new thoughts using that methodology.
We're working with patients and clinicians, and everyone has a different story of how they approach the system. It's really important that those of us who are administrators or work in leadership roles really make sure to be curious and allow sort of those stories to unfold so we can understand them and then move forward and make sure we're addressing the right pieces.
The site visits really provided us with an opportunity to see a lot of these concepts be brought to light. What struck me the most was seeing the possibilities and thinking about ways in which we connect different users of the healthcare system and creating that continuity of care, and how can I take some of those learnings and apply it to the context in which I work.
I think the most valuable takeaway for me, especially coming from an IT-heavy place like Stanford, is it's not about the technology, it's about the strategy that's then informed and supported by the technology. And if you're someone who's really wanting to dive deep into healthcare and be a leader in all facets of healthcare, not just healthcare management from a hospital base, but across the life cycle, then this is the right program.